All right, so I guess it's about 12:30, so I guess I'll go ahead and get started. Um, all right, so I'm Katie Shelor. I'm the pediatric nurse practitioner at Peds Neurology. So I just wanted to talk a little bit today, just because I see lots and lots of headaches, about some conservative measures that we can take for headache management. It's kind of probably going to be more of a review, but kind of why these things are important and some things that you might be able to use in practice. So today I'm probably going to be discussing mostly about the most common headaches that we see in children and adolescents, and then the overview of medication overuse headaches, just because I've been seeing kind of an influx of this recently. Lifestyle modifications that are important to headaches, and then supplements that may help headaches that parents can get over the counter or we can prescribe, and then commonly used abortive medications, and then why sometimes I prefer some abortive medications versus other abortive medications. So, two of the most common headaches in children and adolescents are tension headaches and migraines. So if we're talking about tension headaches, typically, that's going to be a bilateral, frontal, temporal areas. Sometimes it can make that band around the head move into the parietal areas. However, children don't always fit into that criteria, so they might complain about head pain that's diffuse. Normally it's a pressure or a tight feeling for them. And again, sometimes this can be a little bit different, and depending on the description, a 6-year-old might tell you something a little bit different. Typically mild to moderate. These are the kids that are working through those headaches. Sometimes tension headaches can be bad enough to where it seems like they need to lay down, but typically they're working through them. They can have some photophobia and phonophobia, typically not a lot of nausea, vomiting, that sort of thing with tension headaches. And normally criteria, we're having more than 10 episodes over a 3-month period of time. And then migraine, different from this tension headaches, but for adolescents and adults, typically that pain is going to be unilateral, but in children and adolescents, sometimes we can see that bilateral frontal pain again. And that can also move into the temporal areas. This is more of a pulsating, throbbing description versus kind of that tightness or pressure. However, this can have tightness and pressure too. At times, I hear that a lot in clinic. This can be moderate to severe. These are more difficult to work through. Most of the time, kids want to lay down. They don't want you to bother them. They want to lay in the dark. Typically, associated symptoms can be nausea, vomiting, photophobia, worsening with movement. Sometimes there's a visual disturbance, so the scotomas, paresthesias, tinnitus can all be associated symptoms with migraines. To meet migraine criteria, you have to have at least 5 episodes lasting 1 to 72 hours for us to say, hey, these are probably migraines. And then I wanted to talk a little bit about secondary headaches too. Just because I've had a few patients in clinic who have come in with things that are probably causing their headaches that maybe we could have treated, and then their headaches will resolve. But obviously, concussions, traumatic brain injuries, you're going to get these kind of chronic headaches afterwards. Concussions, that's probably one of the main things that we see that can be lasting. Infections, intracranial infections, sinus infections, systemic infections like the flu, strep, right? Those can all give you headaches. Homeostasis disorders, so thyroid issues can cause you to have headaches. Hypothyroid, anemia is one that I have seen fairly often, and especially that iron deficient anemia. And if we treat that with iron, I've had several patients that we've treated and then the headaches go away. So that's fortunate for them that was kind of an easier fix. Hypertension, obviously diabetes. You have to think about obesity and how that can kind of cause them to have these symptoms, and how that can kind of play into headaches TMJ disorder. So if you have a lot of TMJ tightness or problems with that area, that can cause us headaches, especially in the temporal regions. IIH, or the idiopathic intracranial hypertension. Luckily, I don't see that too often. The criteria is typically girls after puberty that are overweight, but this can really happen to anybody. We see it with boys, we see it with younger kids. So we just have to watch out for that. If there's any question about that, then obviously we need to do some further evaluation. Sleep disorders like sleep apnea can cause issues like that. So we always want to take a good look at the tonsils and make sure that sleep is not a big factor into why they're having headaches. Sometimes when they come into office, we try some things, especially if we know that lifestyle modifications are going to be a big factor for them. But if you do a CBC or BMP thyroid, you can check and see if their vitamin D is low. Make sure that they're not super anemic, because these are all things that we can treat, and a lot of times it's at least going to help the headaches, and sometimes it makes headaches go away completely. There was one case that I had within the last year, but there was a patient who came in and ended up being pretty severely anemic, and we found out they had Crohn's. We treated the Crohn's, and then this went away, the headaches did, and they were having chronic daily headaches. Medication overuse headaches. So I have seen quite a few patients who have come in to me and they have been prescribed ibuprofen, Tylenol, naproxen, and they think that, hey, I'm just going to use this anytime that I have a headache, and this ends up being, 4, 5, 6, 7 days out of the week, and then their body essentially gets used to this headache, and then it's a little bit harder to break. So typically medication overuse headaches are going to be when we're using a medication for 3 months, but sometimes I've seen it shorter than this, where they're using that for several weeks. Their body starts to get used to those headaches, and then essentially gets mad when they don't have those medications. But again, Tylenol, ibuprofen, aspirin, the butalbital, the Benadryl can all cause these headaches if they're taking them most days. A lot of times they're going to wake up first thing in the morning, they're going to complain of headache. And this is because why? So they took this headache medication at night. When they woke up in the morning, that medication is worn off. And so they're having this really bad headache first thing in the morning. So then they'll take medicine again, right, to treat this headache. And then by late afternoon, they're going to start getting that headache back really bad because their body is kind of dependent on this medication at this time. And they start to have those headaches that are worsening. Sometimes this can be a really hard thing to break. I always recommend going at least 7 to 10 days off of a medication. And then we can start some sort of other medication in the meantime if they can't tolerate stopping it kind of completely cold turkey. But that's typically what we recommend to get rid of these medication overuse headaches. But again, typically do not recommend using any abortive medications more than 2 or 3 times per week. So I just want to talk a little bit about the physiology of headaches, just because it's going to play into kind of the things that I'm going to talk about in just a little bit. So overall, we're not able to fully explain why migraines really happen. So we think that there's some of this cortical spreading depression, which can cause this inflammatory effect. And so that's kind of the depolarization that spreads across the cerebral cortex. And then there's neurogenic inflammation that we know that happens, so which prolongs and intensifies migraines overall. And then there's kind of this loose correlation with oxidative stress. So these free radicals that are kind of around wreaking havoc. But these can be related to migraine and other sorts of headaches. And we'll kind of wrap around back to that in just a minute. So I just wanted to go through lifestyle modifications that I talk to my patients about pretty much every time they come in. I quiz them on it actually. But these are some things that are easy, especially for parents that don't really want to start any medications, which I have several parents or a good majority of parents who are very hesitant to start medications, which I understand. And if we can fix it with these things, then why not fix it with easy lifestyle modifications, things that they should be doing anyways, but maybe they just haven't been counseled about, or maybe they have been counseled about and they just need to hear it from somebody different. So hydration is typically a big factor into headaches. So reading studies, about 54% of children and adolescents are inadequately hydrated overall. So maybe they're drinking a little bit of water, but just not kind of where they need to be. And inadequate hydration definitely has a correlation with headaches. And it can put a strain. So dehydration puts a strain on pretty much every system in your body, right? Circulatory system, metabolism, waste removal. So even mild dehydration can cause you to have headaches. For adult size adolescents, 8 to 10 cups per day. I really like to go by how many kilos they are. So, or you can do half their weight in pounds. So if they're 40 pounds, then they get 20 ounces of water per day. But if they're, 40 kilos, and I say, hey, you need about 40 kilos per day, and I guesstimate that a little bit, and we kind of go from there. Plain water is typically best, obviously. Unless you are just sweating profusely and you are an athlete, maybe a Gatorade per day. I typically don't even recommend that. Your body pretty much can help replenish those things on its own by eating and drinking. Flavoring is okay. So a lot of kids don't like plain water, unfortunately. So I just recommend if they are going to flavor that those packets or the flavoring they have don't have a lot of caffeine and sugar in them, and then always try to push, plain old water. And this is shocking to me, but in one study, almost a fourth, 25% of 16 to 19-year-olds did not intake any plain water throughout the day at all. So you can kind of see how that could cause some headache issues. All right, and eating. So this is another big thing that I see a lot. So in one study, approximately 45% of children and adolescents complained of headaches after a regular intake of meals. Especially breakfast. So you're thinking about starving yourself kind of all night long. You're not eating anything. When you get up and get going, your body needs that fuel to get going. And if it doesn't have it and has to go looking for it, sometimes this can trigger those headaches. So a lot of times when we're skipping meals, those headache attacks are going to be more painful. They're probably going to pop up more often. And I always, recommend a well-balanced diet, but eating anything at that point, instead of skipping meals is better. So I just recommend that they make sure that they're eating a little bit of something. It doesn't have to be anything big. It doesn't have to be a big breakfast. A lot of teenagers, kids even will complain that they're nauseous in the morning, or they just don't feel like eating in the morning. And I say, if you eat a handful of Cheerios on your way out the door, that's better than not eating anything. Caffeine intake. So I see a lot of teenagers who drink a lot of caffeine. So whether it's coffee or energy drinks, which I hate, but we typically have to kind of run through this with a lot of the teenagers. Now you can see this diagram on the right here. So that really shows you how caffeine can treat headaches, but it can also be a trigger. And it's really confusing on how it can do both at the same time. So you can have this caffeine withdrawal and this caffeine overuse, how it can trigger headaches if you're using it sparingly, or if you're using it consistently, it can help treat headaches. So you have to be very careful kind of where you walk the line with this. But overuse of caffeine is more likely to be a trigger for children and adolescents rather than adults. It can cause you to have a diuretic effect. So if you're already dehydrated and then you have this caffeine, then you're making yourself more dehydrated, right? Which is a trigger for headaches. So we just have to really focus on trying to decrease their caffeine intake overall. Some teenagers will complain that they're having these weekend headaches. So that is where they're having caffeine every day at a certain time of day, and then they sleep in on the weekends. And then they get these headaches that are really bad on the weekends. And maybe it was because they didn't have that caffeine at the right time, or maybe they skipped it totally because it was the weekend. And then in some instances, it can cause vasoconstriction, which can help treat headaches and migraines. So that's typically when you're using it sparingly, and your body's not used to it all the time. And this is actually a little bit of a, if you guys saw my presentation in the fall, but sleep and melatonin and why it's important to headaches. So sleep disturbance is widely accepted as a possible trigger to headaches. We know that sleeping too little, too much, being on an odd sleep schedule, which a lot of teenagers are, can absolutely cause headaches. Circadian rhythm dysfunction can cause cluster headaches. Didn't really go over that, and I don't see that too often, but that can definitely happen. Migraines, typically migraine sufferers complain more of insomnia and sleep initiation issues. And then sleep is important for headaches because it clears the brain of waste. That cortical activity slows, so we're not having that excitability in the brain that we know can cause headaches. And I typically, let's see. So I just wanted to mention that lack of sleep and excessive sleep can both cause headaches. And irregular melatonin production can definitely cause headaches. And then on the next slide. So I wanted to talk about a little bit why melatonin is important in the brain. So, and how we can achieve making our own melatonin versus kind of getting this outside melatonin, which may or may not help. But typically if you're turning off screens 1 or 2 hours before bedtime, your body starts to make that melatonin. And the reason for that is screens kind of trick your body into thinking that it's light outside. So you continue to make serotonin, and then that depletes sort of how your body's making melatonin. And we need it to make melatonin so your body can do that good reset. And we know the good things that melatonin can be an anti-inflammatory effect on the brain. And then it can also, that oxidative stress that I was talking about, that's kind of loosely correlated with migraines, melatonin should be able to help with that. And then lastly, for lifestyle modifications, vitamin D deficiency can be a big factor into some people's headaches. There is a correlation with headaches, tension, migraine, cluster headaches in people that have low vitamin D. The statistics are pretty staggering. So anywhere between 30 to 80% of children and adolescents are deficient in vitamin D at any time. I would probably say probably upwards of 70% of the patients that I do test come back and they're deficient in some way. And some of them are really, really low. And sometimes we supplement or we get them out in the sun and that gets better. But biggest factors for low vitamin D is lack of sun exposure. We just don't go outside like we used to. Or we kind of excessively put on the sunscreen that stops absorption. Obesity, malabsorption of vitamin D in general. Maybe there's something else going on that they're not absorbing this. Dark pigmented skin can be a factor in how they absorb the vitamin D. But these can all cause headaches to be worse and to happen more frequently. And some studies indicate lower amounts of headaches during the summer, possibly related to vitamin D deficiency. So you can see how that could be, right? Summer, you're getting out into the sun more. I don't know if that is always 100%. I think summer is also a less stressful time for a lot of kids and teenagers. So we see them less so in the summer having headaches. And that sometimes I think it might be school related as well. So maybe a factor of both of these things are causing them to have less headaches. Vitamin D can cause kind of an anti-inflammatory effect and help decrease headaches overall. So the best source of your vitamin D is going to be the sun. So getting out in the sun, we can supplement if we need to do that. And I do that fairly often if we check and we feel like, hey, this is low enough that we need to do something about. And then sometimes headaches improve from just that. This is just an example of something that I add on to pretty much everybody who comes to see me for headaches. So I'll call it headache homework, which is probably not the most delightful thing to call this, but it's just something quick and easy. And if you guys wanted to use something like this, or you don't have time to counsel them, you can say, hey, there's these recommendations I've put on your after visit summary, and this hopefully will help headaches. And you know, many times it's at least helping headaches when I give them this headache homework if they actually follow it. And they come back and they either say, you know, hey, this helped a whole lot, we don't need to do anything further. Then we can follow up on an as needed basis, which is nice. Or we have to kind of go a step further and kind of figure out what else we're going to do for them. But typically I say, you know, you need to drink this much water per day, activity 15 minutes per day in the sun, try to turn off all electronics at the screen 1 hour before bedtime, sleep X amount of hours per night. So that changes, you know, right throughout the life. Eat meals regularly, always eat breakfast. Breakfast is typically the ones that get skipped the most, as I said before. Caffeine, I say 1 or 2 times per week is a surprise. Always surprise your body with caffeine. Don't be relying on it. Abortive medications like ibuprofen, Aleve, naproxen, Tylenol, no more than 3 times per week. 2 times per week is probably better. And then down here, I typically have a place where we put medications so they can kind of have all of that in one place. And then I tell them to tear it off, hang it on their refrigerator or on their mirror, wherever they're going to look at it, so they can follow it every day. Do I expect them to be perfect every single day? No. But for me to help them with their headaches, I do expect them to at least try to keep up on most of these things. This is a headache calendar that I use at times, but it's from Boston's Children. The reason I like this one is because it makes them kind of sit down and think about what they were doing during the headache or after the headache. And it's a good place if you print out a few of these, they can really keep track of them. Now, getting kids and teenagers to fill out a headache calendar is very difficult. So there's a more simple one that I use as well that actually Dr. Wilson came up with, but it just has them track kind of when they're having a headache, so we can actually see if what they're reporting is consistent with what's actually happening. But this headache calendar I like just because they can sometimes pull out like, hey, every time I don't drink enough water or every time I only sleep 5 hours at night, this is when I'm having headaches. And it helps them kind of work through that and helps me kind of get a better understanding of why they're having headaches. And sometimes we just don't know. So a little bit about daily supplementation. So I'm going to kind of go through these a little bit more quickly. But there are 3 supplements that I typically use in practice that I'll go over. But riboflavin is the first one, or vitamin B2. And it's a pretty safe supplement. Side effects for this one are pretty low. So stomach upset sometimes. Otherwise, I don't hear a lot of complaints with the vitamin B2, and it's a smaller tablet, so a lot of people can swallow it. Hard to find in other formulations though, so if you're looking for a liquid, not as easy to find. But the thought is that the vitamin B2 helps the excitability in the brain, and then can kind of decrease those headaches, and you can kind of see how this works in this diagram here. So 50 to 60% of patients have reduction in migraine days. In adolescents tend to respond more positively than adults in a lot of these studies. And then again, in other studies, there's no difference from the placebo. So maybe it's a placebo effect in some instances, but it seems like adolescents seem to respond a little bit better. I don't typically check vitamin B2 to see if they're low. We just kind of start this anywhere between 100 to 400 milligrams. I bear on the side of caution for any of these things, so I always typically start low and then move up. 200 milligrams in studies seem to be a pretty good sweet spot for most people. Magnesium. So low magnesium can cause that oxidative stress again, which is thought to be a cause of migraine. And you can kind of see how this works here. So we have this low magnesium, which can cause this oxidative stress, this neuroinflammation, that CGRP releasing, which we know correlates with migraines, right? And so the difficult part with this too is you'll want to check, right, to see if they're low in magnesium. However, most studies say people with migraines can have either low or they can have completely normal magnesium levels, but sometimes we supplement with this magnesium and it helps in either case. But normal levels can help control excitability of the brain, and it can decrease overall severity that is happening in the brain if their magnesium is in a normal range. Typically has a positive effect of treating migraine of all ages, normally 9 milligrams per kilogram per day. I start low again, so normally if I am going to start anything like this, it's going to be 250, and then maybe we'll go up from there. You definitely want to make sure that it's the oxide version and not citrate that you're telling your parents about, just because mag citrate is going to make them have a lot of stomach upsets that we don't really want as a side effect. And magnesium, again, in the blood, if you're looking at blood levels, it's kind of hard to say. Again, just because 1% of it is in your blood, the other 99% is in your blood and muscle so this can fluctuate, from day to day. So one day you might check it might be normal, one day it might be low, but typically it's well tolerated. It can cause stomach upset, so I always recommend that they eat with it. And I was going to say that the pills are really large, unfortunately. So normally when we're talking about supplementing this, if it's a younger kid or kids who can't tolerate large tablets, that's going to be a no-go. So we kind of have to watch and see how this goes. And again, other formulations of magnesium are a little bit harder to come by. It can be more expensive. So this one's kind of a toss-up in the air if they can swallow those big tablets or not. Melatonin is another interesting sort of over-the-counter supplement that you can use. So when I was doing my research back on this in the fall, found that in most studies, 1 to 3 milligrams for tension headaches or migraines typically tends to be a sweet spot. Again, I would start low, and then if you want, you can go up a little bit farther than that. If they're really young, you can use 0.3 milligrams per kilogram per day and kind of calculate it that way. It can be used for abortive or preventative purposes. I don't ever really use it for abortive purposes, but if you are using it abortively, you can use it like in addition to an ibuprofen or naproxen, and it can help with sleep, which we know helps with headaches overall, right? It gives you that reset, helps that brain kind of calm down. And it's about 50% reduction in headaches and approximately 55 to 75% of migraines, and then 67% in tension headaches. And you definitely want to think about this more too for kids that are already having sleep problems. This might be a good place to start and see if this and lifestyle modifications work really well together. So abortive medications, I just wanted to run through these. These are kind of things that we use, fairly often when we're talking about headaches. But Tylenol, obviously we use that fairly often. Dosing is 10 to 15 milligrams per kilogram per dose. Obviously no more than 4,000 milligrams in a day, or 75 milligrams per kilogram per day is kind of your top dose. Ibuprofen in some studies seem to be superior for headaches versus Tylenol. But the studies are, most studies are equivocal, so these work about the same. Ibuprofen, when we're talking about our adolescents or our 12-year-olds or up, 400 milligrams showed the biggest relief of headaches versus like 200 or 600. About 57% of study participants compared to 26% in the placebo. Typically well tolerated without major side effect if you're using it sparingly like you should, so no more than 2 or 3 times per week. And can be used in children 6+ months or older. And again, dosing down here, 4 to 10 milligrams per kilogram for less than 12. And then typically we recommend, that 400 milligram kind of dosage. You can go up from there to see if it works any better every 6 to 8 hours. And again, when I'm saying don't use any of these medications more than 3 times per week, I'm not saying use Tylenol 3 times per week, ibuprofen 3 times per week. I'm saying if you use Tylenol one day, ibuprofen the next day, Tylenol the next day, like I want you to be done for the week. So no more than 3 days combined. And if they're having more headaches than that, and we need to talk about doing something different, I always get them to call the clinic. Naproxen. So if we're going like the next step up, I really like naproxen. It seems to work well for a lot of the tension headaches and migraines that I see. And again, typically well tolerated, but 5 to 7 milligrams per kilogram per day, no more than 1,000 milligrams per day. So normally we're going anywhere from like 250 to 500 milligrams. You can use this in younger kids, 6 or older. Normally I'm using this for 12 and up, but sometimes we'll kind of get to this when they're a little bit younger. And it was statistically superior to the placebo on many of the studies for headache and migraine relief. So I really like that one if we need to step up from this Tylenol and ibuprofen, but typically we start here and kind of go to that. Excedrin migraine. So this has the Tylenol, aspirin, and caffeine all in one. You do have some more side effects with this one with the caffeine just because it can make you jittery. I only recommend it for 12 plus, typically 1 to 2 tablets. Normally, again, bear on the side of caution, start with 1, and then if that's not effective, then you can go up to 2. So with the aspirin part of it, obviously, if there's any kids or teenagers who are recovering from flu-like illnesses or chickenpox, you have to make sure that we're not going into Rye syndrome if they're having any other behavioral side effects or nausea, vomiting. So got to be careful with that one. Typically use it for teens that are older. Triptans. The only triptan that is oral that is approved for 6 and up is Maxalt or rizatriptan. And recommendations are they can start, if they're more than 40 or less than 40 kilograms, they can start with 5 milligrams per dose. Normally don't recommend more than 1 dose in a 24-hour period. A lot of times when they're younger, I start off with 2.5 milligrams, so half a tablet, and then we can see how that goes. And if that works well, then they can move up to 5 milligrams as long as they're not having side effects. Greater than 40 kilograms, they can do a 10 milligram dose. But again, I still bear on the side of caution. I think the least amount of medication that you can get away with and it works. So I normally start with the 5 and kind of go up from there. Sumatriptan or Imitrex, the intranasal and sub-Q have been approved for 6 years and older, but oral dosing has technically not been studied or approved for less than 18, which is shocking to me since Imitrex seems to be one of the most popular ones. So I typically start with the rizatriptan and move to the Imitrex. They work similarly in a lot of the patients that I see, but sometimes one will work better than the other. Fiorset. So the least favorite, right? So it's got the butalbital in it, and caffeine and Tylenol. I would not use it for anybody under 12 years old. So it's banned in other countries because the studies are unclear on how the butalbital actually